say out of all the medical careers that you can do, it's one that you can really tailor to what you enjoy and what you like. You can be a purely clinical GP if you like that. If you like more emergency things, you can do out of hours. If you like teaching, you can do that, and there's so much flexibility within it. Whereas I know from other specialties it's much more difficult to have that flexible career that you might want.
I can be in the community, I can build lasting longer term relationships with patients and their families, but the fact you can also do your other interests alongside that, so you can do academics, you can do research, you can teach, it gives you more flexibility.
In terms of working with patients, I think like you get to meet patients from all walks of life, and you have that in any specialty, but I feel like you get to actually build a relationship with these people, and loads of people have known their doctor for years, so I think if that sort of aspect of holistically caring for somebody and seeing them all the way through their life, if that appeals to you like it does to me, then there's more chance of working where you want to as well, instead of having to move somewhere far away just to get the job that you want. One GP I met decided to work on a cruise ship for like 9 months, another one decided to do expedition medicine, another one being like a ringside physician for boxing matches.
So my dad has quite severe disability and associated sort of mental health conditions and things like that. And I became a young carer in a very short period of time when I was in high school, at a time where I was also having to try and do exams, and I knew I wanted to do medicine, and I was under a lot of pressure. I didn't go to best school, so there wasn't always the support that I needed. And so my GP was a massive support system for my family. So when I went to him first experiencing mental health issues, he was able to offer the support and understand where my issues were coming from. And my GP has supported me through my whole application to medicine, sort of cheering me on despite like my mental health issues and everything, and has always been there to support my family.
For me, GP was what I wanted to do. I enjoyed that fact that it encompasses so many specialties. It really gets your brain working and thinking, I've got this patient in front of me, what am I going to do? Am I going to, go down an acute setting, send them up to hospital? You need to think about your referrals. Do you go urgent? Do you go routine? There's so many different things that you can think about in GP. In hospital, you're able to, hand over your patients to your team. There's always going to be a team there day and night, and you hand over any concerns about a patient. But in GP, you're seeing them or speaking to them for 10 minutes, and then you need to decide what are you going to do. So I do find it quite challenging to, shut the door on one patient and think, this is my plan, and then quickly move on to the next patient.
So I've had the privilege of growing up both in urban and rural environments. And I really, having seen both sides of the coin in terms of general practice and just lifestyle, I really fancy going back to the rural GP side of things. I like the engagement you get with the community, and with general practice you're able to move to these slightly further away places, and that is something that I'd really like to do.
I think my preconceptions of GP were maybe slightly negative before I started medical school. I think I hadn't really had any exposure to it. I hadn't really appreciated what GPs did. And then with VS and things like that, we had sort of more exposure to GPs, more chance to talk about these things. And I kind of could see the benefit of being sort of more in a community environment. And then I did an SSC in second year in social determinants of health, which I really enjoyed. I think it's still like the best thing I've done in med school. And I went to prisons, I went to the deep end GPs, I went to community services, and got to see lots of kind of continuity of care.
My very first day of general practice, we kind of had to do consultations by ourselves and then report back to our supervisor. And a guy came in and he was suffering pretty bad with his mental health. He was really being quite vulnerable and forthcoming for the first time ever, and I wasn't prepared for that. It stuck in my head because I guess like GPs are the first port of call for some people. So I think that just really hit me because he trusted me, so that was really cool.
So I was a medical student at my current practice that I'm training at. I did my 3rd year medical student placement there, which was sort of the every 2 weeks that you went. And then we, myself and a friend, we went back and did an SSC there as well for a month, which was really good. And I'd kept in contact with some of the GPs there and had told them that I wanted to be, or do GP training. So it just worked really well that I could go back for my training.
In my first year, I applied for the COMET programme, which is the community-oriented medical education track, I think. It's basically giving you more exposure to general practice. So in 3rd year, when you transition to doing your placements, you get regular attachments with the same GP from then right through until you graduate, as well as in your final couple of weeks in like your prep for practice weeks. So I think it was the continuity of having a single practice that I could be attached to and really immerse myself in learning what life is like as a GP.
So after my 3rd year, I did a BSc in global health. So this was my first ever experience of research of really global health. To be honest, I didn't really know what it was. I just knew I thought I was probably interested in it. And Andrea Williamson was my supervisor. So she was running the BSc at the time, and she was also my supervisor for my project. And that she was a GP, but she was also doing this research that it wasn't in a lab, which what I thought research was. It was going out there, speaking to people and learning about how people who are very marginalised are supported within the community. And I saw her job and I thought that's something that maybe I would like to do, or maybe I could do.
I think the recovery community was one of the nicest places I went to. I think people told us stories about their lives which were horrific, the things that they'd been to, the way they'd been, and they just told us all of these things about them. I've come so far, I'm so happy with what I'm doing now, I want to give things back. It was a very positive experience, and it was quite humbling, actually.
The thing about general practice that really stands out to me is this, like, seeing the same people again and again. I like that ability to actually build a slightly deeper relationship. The more social side of things, I guess, as well as the medical side of things. So that would definitely be my kind of main light of what GP could offer.
I actually realised through general practice that you don't need to just work in a general practice to be a GP. You could be a GP and also have a special interest in A&E and do a few shifts there and have a few special interests in other things. Instead of having to choose between one or the other, I feel like I could maybe have my cake and eat it a little bit, which is quite nice.
When I think about being a GP, I get really excited. When I'm being in GP for placement, I just feel settled and it just feels right. And I really just think it's what I'm supposed to do with my life.